situation in our life, especially if it is have to do with annihilation of our group, for example, or annihilation, existential annihilation of our group, like in genocide. For example, from the war, conflict, intergroup conflict between uh, Kurdish and Saddam Hussein, he wants to eliminate or annihilate the Kurds. Then he used the weapon of mass destruction, which is the gas against them to try to eliminate them. And it happened in Halabja, and then he attacked them by gas. And in this attack, he killed in one thing, he killed 5,000 in one attack. And then the question, how can the people cope with uh, elimin the elimination? How can we cope with the threat of elimination and annihilation, existential annihilation? Can you change the, yeah. Then our study investigate the collective and individual coping strategies that survival used and their descendant use for this kind of event, when we used Halabja chemical attack as example. It is mixed method design. We use the mixed method design, and that involved 518 participants, of whom 50.8% were females, and 43% were survivor, and 56% were offspring. Data were collected from Halabja, which is a city in the Kurdish area that had been attacked with, and we'll talk more in detail about Halabja. But this data was collected from the Halabja city that have been subjected to the attack. That is, we are talking about attack have been happening 35 years ago. We see how this 35 years ago, how people have been attacked and their offspring is still suffering from that. And then we collected this data from Halabja and the east neighboring area between August and November 2023, which is around 35 years after the event, which it happened in 2014, I think. Participants completed self-administered questionnaire assessing their exposure to Halabja chemical attack, assessing mental health, assessing their executive function and resilience, post-traumatic growth, and also open-ended question included ask their coping. What happened? How did you cope to this? What did you see to cope? What did you do to cope with this event? We did the thematic analysis to reveal what the distinct coping, collective and personal coping strategies you use, the subjects use to this event. How did you cope? What did you do to cope to this event when this happened? And we used after this one way ANOVA to analyze the relationship between the severity of exposure Halabja attack, the mental health, the cognitive variables, the post-traumatic growth as a dependent variable, and the identified coping strategy as the factors they identified, they said that helped them. We also examine the differences in coping between survival and the descendant. Uh, Basically, I just to make it to make it you know to summarize before we get to the details. Religious coping emerged as the most associated with the higher severity of exposure to the genocide. Conversely, the offspring showed greater resilience on social support, collective coping, and the lesser dependence on religious coping. Will to survive personal coping were associated with high scores of complex PTSD, depression, and anxiety. Keeping busy, remaining active, seeking social support, and using coping like time heals or accepting reality indicative a mix of mixed flexible coping were associated with higher school of post-traumatic growth and resilience. And we will discuss the conceptual and the clinical implication of this finding by the end, and the relevance to coping research. Please, next.
Give me a second.
That's the highlight.
Okay.
Then coping with genocide attempt.
Okay.
Iraqi Kurdish genocide Anfal campaign killed between 150,000 and 180,000 people and destroyed some 450 Kurdish villages from the 1960 to 1980, and reached peak violence during the Iran-Iraq War 1980 to 1988. The chemical attack on Halabja, a city of Iraqi Kurdistan, on 16 March 1988, remains one of the most genocidal acts using chemical weapons against civilians that to eliminate or subjugate the Iraqi Kurdish group. The attack resulted in the deaths of over 5,000 individuals and left thousands more with enduring physical and psychological scars. Traumatic events of this magnitude profoundly disrupt lives, needing effective and innovative coping strategy to mitigate stress, foster resilience, and normalize their lives. Please, the second one, please. Please. Second one. The threat, no. Okay.
Which one do you want?
Okay, the threat.
So this was the ones you had before, so that was...
Okay.
Do you want to continue? Should we go to the methods then, or what?
Okay. The threat of group annihilation in severe intergroup conflict, like Halabja, entail different coping strategies than coping with interpersonal violence. Problem-focused and emotion-focused mechanisms that help manage interpersonal stressors may not be enough to manage intergroup, genocidal, and collective stressors. Adaptive coping mechanisms such as seeking social support, seeking higher power support through religiosity, or finding meaning through spirituality, or will to fight, not flight, live to survive, have been associated with reduced stress and executive function deficits and less executive function deficit. Further, generational differences in coping are evident with offspring of survivors, favoring social support over traditional strategies like faith. The Halabja chemical attack provides a unique case for examining coping with attempted annihilation. Specifically, how did they cope with the annihilation threat and the resulted adverse mental health condition such as PTSD, complex PTSD, depression, anxiety, and the cognitive processing deficit resulted from the mental health issues. The research question, we have two research questions. What are the strategies utilized by Halabja survivors to cope with the collective identity annihilation threat, which is the genocidal chemical attack, and its adverse mental health and cognitive impact, like PTSD, complex PTSD, depression, anxiety, and working memory deficits? The second research question, what are the differences in coping strategy between the survivors and the offspring? Yes, please. Please change the slide. But this method
is want to go okay. For the
no, sorry.
Which slides do you want?
The one before, yeah. Okay, the participant in this study, included individual who experienced exposure to the chemical attack, survivors, and their children. The exclusion criteria were individuals who were neither present during nor exposed to the chemical attack, and other family members, including first and second degree relatives of the survivor, as well as second and third generation survivors. The sample included 518 participants. The gender distribution was almost equal, with women comprising 50.8%. And most of the participants fell within the age group between 30 to 49 years old, followed by 18 to 29 years and 50 to 69 years. A similar proportion of the participants were 70 years and older. Regarding employment, almost half of the participants reported being unemployed, while 24% were government employees. Students account for 14%, with a smaller proportion working in the private sector or retired. In terms of social status, the majority of participants were married, and the single participant comprised of 27%. The remaining participants were either divorced or widowed. Can you change, please? Yeah. And you see in, can you change that as, explaining more the detail of the demographic, we just talk about it. Can you change the next slide, please? We used a mixed method design, incorporating both quantitative and qualitative methods to examine the coping strategies employed by survivors of the Halabja chemical attack and their descendants. Qualitative methods involve standardized measures to assess mental health conditions such as PTSD, complex PTSD, depression, and executive function. Qualitative methods included interview to explore coping mechanisms used by survivors to endure the aftermath of the attack, and by offspring to manage the intergenerational impact of their parents' trauma and the mental health and cognitive impact of their severe trauma. The data of this study was collected between August and November 2023. We conducted a structural interview and used self-administered scales to measure variables related to mental health and executive function deficits. To ensure cultural and linguistic appropriateness, 4 trained interviewers fluent in Kurdish conducted the interviews with the participants. The research was carried out in Halabja, the city where the attack occurred, as well as in the surrounding area of Sirwan and the Kormal and nearby villages, where many survivors and their descendants currently live. The questionnaire included 10 questions designed to assess attention. Also, the study is to make sure they pay attention if they fail 3 questions of the 10, they get out of they deleted from the sample. The study received approval from the university, and the IRB university informed consent was obtained from all participants, and the confidentiality of their information were explained. The measure we used, we devised measure for Halabja severity exposure scale that have we used exploratory and confirmatory factor analysis, and the scale have good validity and reliability. We use the International Trauma Questionnaire that measure PTSD and the complex PTSD. We used cumulative stressor and trauma scale that measure different trauma types, 6 types of trauma, and they measure trauma profile. We used and they also measure genocide. We used generalized anxiety disorder and the measure for depression patient health questionnaire. We used adult executive function inventory that we measure working memory deficit and inhibition deficit. We used the Corner-Davison resilience scale that measures resilience. We used post-growth inventory that measure post-traumatic growth. We used them as a question for demographics. And of course, we're using a coping strategy, which would be part of the qualitative part, with the question about the qualitative part. Please. Next, please. To analyze the statistical analysis, we utilized cong guidelines to determine the sample size required to detect a medium effect size. Okay. To make for the quantitative part, we use the power to determine the sample size. In the guideline indicated that a sample size of 64 was necessary for conducting ANOVA. But in the same time, to conduct AMOS, to conduct AMOS, to conduct structural equation modular or Bath analysis required. You recommend 200 to 500. Then our sample, which is 400 over 400, then it is appropriate for our statistically for our purpose. We used IBM SPSS and AMOS 28, and we use GASP also 18.3 to analyze the data. You use thematic analysis to analyze the qualitative data for the resulted from the question, dual qualitative question answering about coping. What coping? Please, thank you. Next one. Results for qualitative thematic analysis based on the data collected from the interviews. The thematic analysis found the 1, 2, 3, 4, 7 themes. First theme was religion and 7 coping strategies. Religion and spirituality. They include answers such as pray, God's mercy, faith in God, reading the Quran as coping to the Halabja chemical attack. The other one is time heals and acceptance. This category includes a response that highlights the importance of accepting the passage of time as a way to heal or cope with the trauma. Phrases like life goes on, deal with reality, focus on the present, and acceptance and the necessity. And another coping strategy was family support. Response in this category emphasize the significance of family relationship, particularly the role of good parenting and strong relationship with family members, we should consider critical for support. Another coping strategy was found as social support, example, community support and social networking. These responses illustrate the significance of external social connectedness and support in the healing process. So social support is primarily a collective coping mechanism. Another thematic coping strategy was keeping busy. This category captures response that suggests engaging in various activity as a way to rise above trauma. Example include working, reading, and getting involved in positive pursuit. Another coping strategy is leaving the location, supposing like discuss like physically leaving the site of the chemical attack as changing the environment or immigrating. The other coping strategy of the last one was will to survive. Response that demonstrates inner strength and determination to survive and fight the oppressor. This answer emphasized the importance of personal strength, self-confidence, finding meaning in life, and a strong will to survive and fight. This coping strategy can be applied both individually and collectively. This is the qualitative part, and we put this qualitative and we put this qualitative part in a point, and we do it. We put it in we point and put it in the in ANOVA with the mental health. We would measure mental health measures in ANOVA. See how this will be. Will first we compare the mental health, the response of this response of survivor with the survivor with the offspring and their coping. See how different. In the same time, we put those on, compare this coping with in ANOVA, how this measure with the others.
Can I?
Okay.
Yes.
Okay. There's just here comparison.
I'm sorry to say you have to come to, you have half an hour is over. So if you can just try to summarize.
Okay.
Yeah.
Okay. Among the participants surveyed, the strategy was utilized by 50 survivor, by the survivor, the collective, another, basically, to summarize, making the strategy would utilize by 50 survivor, making the most frequently used approach for is the okay. Among the survivor, this group comprised the most commonly reported coping mechanism was time heals, which reflect acceptance and the ability to deal with the present. This strategy was used by 50 survivors and 15 offspring, making it the most frequently used approach for both groups. Another coping strategy was social support, a collective or social method of coping, which was used more by offspring. In this case, 31 survivor and the 11 spring reported utilizing this strategy. Additionally, religion and spirituality were primary collective coping mechanisms were significant for survivor, but with not as significant for offspring. They were not used as much by offspring. Can we take the other? Can we move to the other one? We're using when we use the ANOVA, with the ANOVA, see how the coping was actually, and how the coping strategy went through the get with the annihilation with the different scales. Then annihilation scale, annihilation threat severity, which is the coping with the annihilation threat severity. We found that spirituality was number one. Coping with annihilation threat severity. When the measure we developed for annihilation threat severity, then we found that spirituality is number one, followed by will to survive. Please, second. And this is, you can see here, spirituality, followed by will to survive. Okay, next one. Okay, coping strategy with cumulative life trauma. When the number of trauma, the cumulative life trauma, we found the uh, will to survive and to fight is the strongest one, the most strongest coping strategy with cumulative life trauma, followed uh, by spirituality. The second one, please. You see here, will to survive, followed by spirituality. Okay. Okay. Second one, coping with PTSD severity. We find the same thing. Will to survive is the strongest coping mechanism, followed by spirituality. Okay. That second, next one, please. Coping with the working memory deficits. But when they cope, when they don't know what to do, they don't remember how they cope. We found the first coping mechanism with them is spirituality, followed by uh, leaving space. Okay. Uh, the next one, this when how they said how people who has higher post-traumatic growth cope. They said people who has post-traumatic growth coping, the best coping for them is keeping themselves busy and social support. They're keeping themselves busy keeping yourself busy and being special, being participant, keeping myself busy scores the highest on post-traumatic growth. But by those followed by those who utilize social support and those who utilize time healed and realistic acceptance of life as it is. That is those who actually have higher post-traumatic growth. Next, please. And with the same, we find it for for resilience. I didn't see here resilience. Okay, but we find the same for resilience, like post-traumatic growth. Basically, the analysis of coping strategies among survivors of the Halabja existential annihilation threat and their descendants reveals significant variability is the method used to manage the severity of trauma and its mental health and cognitive impact. Generally, religion and spirituality emerged as the most prominent coping strategy for those with the highest severity of genocide exposure. In contrast, the strategy keeping myself busy, essentially transcending stressors, was associated with lower level of genocide exposure and was linked to higher scores of post-traumatic growth and resilience. Those findings align with other studies too on coping mechanisms that overcome trauma in post-genocide in Rwanda, which indicated that faith-based coping strategy are the most commonly utilized and highlighted the crucial role of religion coping in fostering resilience. And the sense here in collective coping and the collective coping with the 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 event that is beyond your the collective coping بالإيمان that collective coping for events that is beyond your that threaten your beyond it threaten your existence or group existence. Then here religion and spirituality come to but for people who are resilient, dealing with the reality of dealing with the present and the reality and the dealing and the getting above stressors. It is the way to they deal with the stressors. Uh, this also has to do with culture because religion is notable for the Islamic religious movement and its proximity to the area of Sufism in this area, Islamic mysticism in the area that this event happened. Thank you.
Yeah, thanks for this interesting talk. I think we're a little bit, running out of time, and